adenoma, then cancer. Okay. So did you guys get that? Polyps, adenomyoma, meiosis, leiomyoma, and then cancer, which is malignancy. That's what the PALM word stands for. Okay. Don't worry, I'm gonna post this on the website. So good. So what do you think we should do to this patient? Now we know what she may have. She may have cancer. What else we should do to this patient?
How about the others? How about Linh?
So you think that we should do nothing unless she go home? Is that what we think? Because now we know that she have cancer. Let's just go home and send her to oncology and let they treat her. You think we should do that?
So,
What do you think, Lynn?
I think in this case we should to do for this patient for this endometrial biopsy to confirm the condition of the condition of this patient. So I think so. So I choose the answer is C.
C is the correct answer. So for postmenopausal women, if they come with bleeding, in America, endometrial biopsy is the gold standard. Okay. I don't know about how you guys practice in Vietnam. Maybe you do the ultrasound first, but in America, we do endometrial biopsy for women age 50 or above with abnormal uterine bleeding, because some research say that transvaginal ultrasound is good initial test, but they miss about 3 or 4% of patients with endometrial cancer. So sometimes the transvaginal ultrasound reveal the thickness only like 4 or 3, but the thing is we don't know what type of cells in the uterus. So endometrial biopsy reveal the type of cells in the uterus. That's why in America they recommend that we do endometrial biopsy, and that's considered the gold standard because it's very high sensitive and very high specificity. You know the term sensitivity and specificity? So if those of you do research, you should know that. But if those of you who don't, then sensitivity is how sensitive the test is. So, and specificity is specifically for endometrial cancer. Okay, that's sensitivity and specificity. It's more research based. So
All
right.
Here know about the terms hysterosalpingogram. Do you know about?
Yeah, do you know what hysterosalpingogram is?
How about we have some people here?
How about Lynn? You know, Lynn, do you know what hysterosalpingogram is?
I know. Can I speak?
Yes, just go ahead.
Go ahead, Phương. It's fine. Yeah.
It's the kind of X-ray to see the history, to see the sapiogram. It's an X-ray that check the shape of the shape of uterine cavity, okay. Using check the shape of the uterine cavity using when we
so let's just dissect the words. So we know you know about the procedure, but you probably can. It's really hard to explain because it's a very complicated procedure. So let's just give everyone a simple definition. Let's dissect the word because medical English is like word put together like puzzles. So what hystero mean? What's hystero? Hystero mean
Uterine.
uterus. What's salpingo mean?
Safingo.
What is the salpings? Have you had a term mesosalpings? Have you had a term mesosalping in medical terms? Salping is a tube to connect to the ovaries. Okay, so hystero salpingo mean that we do something related to the uterus and the tube attached to the uterus. So hystero salpingogram is we want to see the uterus and the tube, see how it goes, and we commonly use this to determine something related to PID, post-inflammatory, pelvic inflammatory disease, see scarring, anything to determine the cause of ectopic pregnancy. So we usually use that for that. Is that right, Phương? Am I saying something wrong?
Phương.
I just want to consult your specialties on why we use that test. So technically, it's X-ray that show you the uterus and the tube. That's it. What is laparoscopy? What is laparoscopy?
We use the endoscopy to check for the abdominal cavity.
Good. We use an endoscope. Stick it in the belly button and look at the abdominal cavity. It's really cool surgery. Those of you who are already in surgery know that. It's really cool. I love that surgery. Why don't we do serum FSH? Last week we talked about FSH. Anyone remember what FSH tell you?
How you think, anh Hoàng, serum SH level, why we cannot do this?
Yeah, why we don't do FSH?
Because in this case, when I read the history, historical about this case, I see the problem of this woman is about the problem with the endometrial and bleeding after the menopause. So with the woman over 60 years old. So in this case, I think about maybe I think so much about the malignant disease. So the first step I want to distinguish the benign and the malignant. So that this is the first step in the endometrial biopsy, and the serum FSH level is not for distinguish the benign or malignant tumor, just for the I don't remember the clearly. So maybe the serum SSS level for the sorry, it's long time.
So that's good. Thank you for the explanation. But FSH should tell you already say that FSH should tell you the menopause. We already know she's in menopause, so
Yes.
don't do that. Okay, good. Yeah, very good explanation. Let's move on to the next case. Now this next case is easier. I always give you.
I want to share some my experience about this case in Vietnamese.
We can do that after we go to the second.
When I read the case, I can see the problem with this woman, and maybe the most important problem in this case is the distinguish between the benign and tumor, benign and malignant tumor. Yeah. So we can do many tests like ultrasound, like MRI or biopsy for this case. And in the real in the clinical we can do everything. We can do all of them at the same time, not just one by one. We can do at the same time. But in this case, because the question is that which one is the best, so we choose the biopsy because biopsy can distinguish the malignant and tumor, malignant and benign. So it is the best test for this case. But in clinical, you can do ultrasound, you can do the MRI or CT scan, and endometrial biopsy at the same time, not step by step.
Yes, thank you for saying that. I know that we can do everything in the same time, but we want to do the one that cost benefit. You remember last time we talked about cost benefit? We don't want to charge the patient with 200 million Vietnam dong.
Yeah.
Right? So in America, we only do endometrial biopsy with this kind of patient.
But with endometrial biopsy, we just diagnose about the cancer on benign, not for the stages or for the next.
Yeah, because in America, we just want to know they have cancer or not, and then
I think
after they have cancer, we do the next steps. Usually, the biopsy can really tell you if they have cancer or not, and then if they have cancer, then we go more about in depth about how to stay.
How about go ahead, Ying.
This case talk, I just want everyone to know, like, okay, screening is have to be pay attention to what important test and cost benefit of the test. So anyway, thank you for sharing the insight. Appreciate that.
Okay, go ahead, Ying. She's have something to talk.
Yes, Wing, you have something to say?
Teaching,
Yes, I think in this case, this patient is menopause. So I think when you know when the endometrial thickness of 5 millimeter, I think the best test is the endometrial biopsy. When I learned in Haiphong University, in my hospital, we always take this test for all women who is
Good.
I agree. I agree.
Clinical man. That's a good step. So thank you for.
And one thing I maybe previous time I said that one thing, if only with the in my hospital, if with the only the biopsy result, we cannot diagnose the cancer or not. Which one test?
I know last week you talked about the 3-step method. Yeah. I totally understand that.
But the key thing here is we didn't talk like how can we manage that patient. That's a whole whole progress to manage patient. But now based on those of information we have here, all of the information we have here, what the best thing we can do for the patient?
I think the best thing is right answers. I just share more information about the clinical.
I agree too.
Thank you for the information. I love
because
I love your 3 steps.
Some doctor until now some doctor think that the biopsy result is the best, so they just believe in the biopsy and don't care about the clinical or another test.
I know. I'm not saying the biopsy is the best, but it's a gold standard that everyone, like, if you don't know what to do, here there's a guideline. Do this, do that. Yeah.
Yes.
Yeah, I
Like
just
me, I don't know
not.
what to do, so I have to
Yeah.
follow guidelines because we
Yeah.
practice based on guidelines and everything. So the
Yeah.
American Cancer Society recommend, hey, endometrial biopsy is a gold standard in the postmenopausal bleeding. So let's just say patient come in with bleeding. You don't know what to
Yeah.
do next. So you assess the patient menopausal status. If they
Mhm.
menopause, go ahead and do biopsy. I'm not saying that not doing ultrasound is ultrasound is fine too. You will see that I put the flow chart after case 2 to show you that hey, you can do ultrasound too if the patient cannot stand the biopsy because sometimes it's too painful. Patient doesn't want to do it. We can go ahead and do ultrasound. That's fine. I just say that is a gold standard that give you the diagnosis quickly and save you some cost for ultrasound. But hey, clinical work is totally different. There's so many management. You do what's best for the patient. Okay, as I always say, do what the best for the patient. Very important. All right, let's move on to case 2. Case 2 is a quick case. Since Lin haven't talked yet, I will have him read this case.
Yes, let me talk this way.
Yes.
A 48-year-old woman comes to the office due to abnormal uterine bleeding. Patient has had several days of heavy bleeding, 2 to 3 weeks for the past 4 months. Last week, she has heavy bleeding with passes of blood clots with protons. Her to be evaluated. More than she have was a
Miniki.
monarchy was as a about 17, and the patient was on the estrogen progestin containing oral contraceptives during most of her
Contraceptives. Now clearly, yeah, contraceptives
during most of her 20s and 30s for treatment of
dysmenorrhea.
Dysmenorrhea, yes.
Dysmenorrhea, yeah.
Dysmenorrhea.
Yes. Please stop taking oral contraceptives as age of 33 when she underwent a tubal ligation after the delivery of her last child, and she has a cervical colonization at the age of 29 after an abnormal pap test, but all subsequent pap tests have been normal. Patient takes no daily medication. She has 20+ years smoking history and denies using alcohol or illicit drugs. Vital signs are normal. BMI is 40, and an endometrial biopsy is performed and so endometrial adenocarcinoma, and what's the following is the most significant risk factor for this patient's biopsy result. The age of menarche, the body mass index, the oral contraceptive use, or the prior abnormal pap test, or the tobacco use.
Good, thank you. So if you follow the case closely, you should have the answer by now. And remember, the last week we discussed what hormone, and I just asked you in the beginning of the case talk, what hormone increased the risk for endometrial cancer. So in this case, I want you to pay attention to what in the patient history telling you that she has a lot of estrogen. So I already give you the answer. Sorry, I should have let you guys discuss. So anyone have any idea what is important? In the case